I'm not going to speak long because really some of the new content of this session is really a lot of what Robin's going to talk about in terms of mitigation and resilience within the healthcare infrastructure. But I'm just going to do sort of a setup for her. So as we start thinking about climate change and rebranding it as a public health issue, these are the kind of images that will replace the images of polar bears on ice caps, is that connecting about what climate change looks like is depending on where you live. This is a slide of Pakistan in 2010 when 20 million people were affected by extreme weather events and flooding. The other thing that we're learning broadly is that the environment has enormous impacts on our health. The World Health Organization estimates that 20% of all the global burden of disease is from the environment. And so the idea that Jonathan said this morning, that you can't have healthy people on a sick planet, that idea is actually gaining more and more traction. The good news is that, as we've been talking about all day, is that if we address the environmental issues that we face, climate change, the toxification of the environment, unsustainable farming practices, if we solve those issues, we're also going to improve the health of everybody on the planet. And inside of that, the healthcare sector is such a fundamental force. There's the issues that we discussed before that Ed's talked about, which is that we're really trusted messengers. But the other part of it is that we take up a huge part of the economy. In this country, healthcare is 18% of the economy. The only thing that's bigger is the military. And globally, healthcare is 10%. So if you can change the healthcare sector, if the healthcare sector can validate this transformation to a toxic-free, low-carbon future, it can show the rest of the economy, the rest of society, how to get there as well. So our work, Healthcare Without Harm, just to say it, is to transform the healthcare sector as that critical sector to be more ecologically sustainable, and then to transform those actors into becoming leading advocates for environmental health and justice in the same across the globe. The idea is that if you've cleaned up your own house, if you've dealt with your own energy, you've dealt with your own toxics, you've kind of cleaned up the facilities that you're operating or your clinics, you're much more likely to become an advocate. You're going to feel more comfortably becoming an advocate because you've kind of taken care of your own home, as it were. And in your own home in healthcare, that means our clinics and our hospitals. I'm not going to go into this, but the Lancet new report that came out is sort of required good reading for this issue. What hasn't been mentioned before is that the Lancet specifically calls out hospitals and health systems around their significant carbon footprint. The estimates from the Journal of American Medical Association is that hospitals alone, not leaving aside all of the supply chain, healthcare supply chain, just hospitals alone contribute 8% of all greenhouse gas emissions in this country. Given how big this country's emissions are, that means that if you took all the hospitals in America and said, if they were a country, how big would those emissions be? American hospitals would be the 10th largest carbon emitters in the world. That's a fascinating thing. So, obviously we need to move them toward low-carbon healthcare. I'm going to skip these slides. The other thing just to say is that as we've been discussing, and as it relates to healthcare infrastructure and health impacts in different regions of the country, it totally depends on where you live in terms of what are the health impacts you're going to get affected, whether it's extreme heat or extreme flooding or more severe storms or hurricanes. It kind of depends on where you live. And so the question is our healthcare infrastructure resilient in the face of climate change? And what we've learned from Hurricane Sandy and Hurricane Katrina and a number of other events is that we are completely unprepared for climate change, that we haven't designed, obviously, we haven't designed our infrastructure, our supply chains, our response to acknowledge those public health impacts of climate change, those extreme weather events. We have a long way to go. In Hurricane Katrina, it was mentioned that a number of the hospitals basically failed. They had to be evacuated. People died. The slide on the bottom left, this is Memorial Hospital in New Orleans where There was no electricity. All the electrical equipment, all the backup generators were in the basement, got totally flooded. People had to go up to the helipad at the top and the parking garages. They had to throw furniture to break the windows on the top floor because it got to be 110 degrees because there was no operable windows and there was no cooling. This was, in the end of August. So it wasn't designed to address climate change. Again, same thing happened in New York, whatever it is, 8 years later. NYU Langone, Bellevue Hospital were both evacuated. Again, all the electrical equipment was in the basement, the backup generators were in the basement. The hospitals failed, which means that people had to be evacuated, which means all the other hospitals in New York got flooded with more people from the people that were evacuated, as well as all of the nursing homes that were in Queens and Far Rockaway and Long Island. So I'm going to turn it to Rob in a second, but I'm going to say that we see three roles fundamentally that the healthcare sector can play in society. And they're unique. It's unique in that way, how profound those roles can be. One is, as I've said, is to mitigate our own footprint within our facilities and our clinics. And lead by example. Let's be the sector of society that makes the transition to a renewable energy economy and shows the rest of society how to go there. Let's be the sector of society that shows how we can reduce the amount of meat that we eat and that has positive health impacts and positive climate impacts. The second important role is resilience. Let's make sure that the infrastructure we have, that the healthcare facilities and clinics that we have, they're the last building standing in extreme weather events. They function. They can operate if the grid fails. They can be the place where there's clean water when the system gets flooded and there's no clean water, so that it is the anchor for the resilience in the community. And that can be designed, and that's what Robin's going to talk about. And then the third role, which is what we've been talking about all day, which is to be messengers, to be advocates for the policies that are going to make this all a lot better. So I'm going to stop there and now turn it over to Robin to talk about the mitigation.